Well, the Center for Social Change at University of Johannesburg, in collaboration with the Developmental, Ethical and Capable State Research Division of the Human Sciences Research Council, have today released the findings of a research on the public support for compulsory workplace Covid-19 vaccination and having to provide proof of vaccination to enter public places. Now, let's discuss this further. We are now joined via Zoom by Professor Carin Runciman, Director of Center for Social Change at the University of Johannesburg. Professor, thank you so much for your time this afternoon. But perhaps before we start to get into the meat of the study, talk to us about why the study was conducted and what methodology was used.
So this is the fifth round of the UJHSRC COVID-19 Democracy Survey. So this is a survey that we've been conducting periodically since the beginning of the pandemic in April 2020. And so we've been using this survey to understand the perception and experiences of adults living in South Africa throughout the pandemic. And in the latest round, round 5, which we've largely conducted online, although we do have a small component of telephone surveying, we did ask these questions around support for vaccine mandates and vaccine passports. And we've spoken to over 6,000 people. So it's quite a good sample to be able to take the temperature of what people are thinking on these issues.
Now, one of your findings, 54% of adults support compulsory workplace COVID-19 vaccination. Of course, the support differs, as you say, significantly by vaccination status according to your findings. Give us a breakdown of these findings, particularly as it relates to those who are supporting this move for compulsory workplace COVID-19 vaccination and vaccine passport.
So absolutely. As you've said, overall, what we found is just over half of adults support these measures. So compulsory workplace vaccinations and the so-called vaccine passport. So having to provide proof of vaccination to enter a range of public spaces. But what we do see is that this level of support differs considerably by vaccination status. So amongst those who are fully vaccinated, the support for these measures goes up to about 75% on both measures. But if you are not vaccinated and do not intend to vaccinate, less than 10% of that group support the introduction of compulsory workplace vaccinations and the vaccine passport. So it really shows how important vaccination status is to shaping perceptions around these policy measures.
And you've broken it further down in terms of demographics, saying that Indian adults, 65% of them are in support of compulsory workplace vaccinations, and so on. It goes Black African adults, 56%, colored adults, 49%, and lowest among white adults, 32%. But what's interesting is that, your study has found that high levels of education seem to be associated with greater opposition to compulsory workplace vaccination and vaccine passport. What are we to make of that?
I think what we're seeing here are some of the intersections around race and class. So as you've already said, the lowest levels of support are amongst white adults for these kinds of measures. Now, what that also relates to is that in the previous 2 rounds of our surveys, which we conducted in January and in July of this year, in both of those rounds, we saw that vaccine hesitancy was actually the highest amongst white adults. So here, I think what we're seeing is that relationship, certainly on this, between race and hesitancy, and therefore the support for these measures. Again, when we come to education, what we are seeing slightly is the intersections of race and class, which we know in South Africa often go hand in hand with one another. And again, I think what this illustrates is some of the relationship around vaccine hesitancy, which has been varying throughout the last year. So at the beginning of the year, what we did see was higher levels of vaccine hesitancy amongst those with a more than matric education. So I think it's very interesting that we see again that sort of the lack of support around some of these measures also corresponds to education. And I think hesitancy might be part of the picture here. So it's a really complex picture where you're kind of seeing how the intersections of vaccine hesitancy are really then shaping important public perceptions around potential policy measures that might be implemented.
I mean, also, it is very interesting because you would expect it to be the other way around almost. So these are people that would normally, comprehend what is being said or what they are reading. So, with this new variant now coming out, and of course we are just, laden with information after information, and also from different quarters, the information differs. We are hearing that new data is coming in as it relates to this new variant, and information is coming in. Do you think that, just the discrepancy in terms of who is of the higher population that is hesitant is because of the miscommunication, or that the communication is not being packaged in a way that everybody should be understanding it, in the same way?
I think obviously when it comes to addressing vaccine hesitancy, good public messaging is absolutely key. And again, based on our past research, what we have seen is that when it comes to information that people trust about COVID-19, this is where television and radio remain absolutely critical channels of communication. So although people might engage in social media, these are not channels that they necessarily trust. So I think it does really put the onus on broadcasters like yourself, but also the other broadcast mediums that we have to really engage in that public messaging. But I think also what comes through here when we think about these issues around education and race, what we've seen throughout the pandemic is how the issues of trust in government and the rating of particularly the president's performance in handling the pandemic has been critical. So if you think President Ramaphosa has been doing a good job in responding to the pandemic, you are much more likely to mask, you're much more likely to vaccinate than if you think he's been doing a bad job. And so I think it's that bigger social context around questions around, do you feel you can trust government? Do you feel that you can trust the information that government is giving you? And of course, in a much wider social and political context where, of course, we know problems of corruption, things that might lead people to distrust government, it's a really complex picture where it can't just be about the medical information alone. It is about that much wider context around issues of trust. And do you feel that you can trust government to, in a sense, look after your best interests?
Professor, thank you so much for your time and unpacking that study for us. Really do appreciate it.